Trehan, one of the most revered cardiologists in the whole country. Now, how did you handle that kind of pressure?
So coming from this sort of a background was damn difficult.
Don't you think that the toxicity is actually increasing every day? KGMU का तो आपको पता ही है 22 hours journey and then गाली अलग से.
कोई सेल्फ एंटाइटलमेंट है कि भाई थर्ड ईयर है तो वो काम नहीं करेगा.
You have to say somebody if they should become a doctor in this era. What would be your suggestion?
या तो आप इंडिया में डॉक्टर हो सकते हो या आप समझदार हो सकते हो.
What would you say are cons of cardiology as a branch?
The problem is that there's no work-life balance.
Maybe an MD or DNB medicine or even MD or DNB pediatrics, they can survive in a top tier city without doing DM, or is DM a must right now? So boss, what would be your advice to a new cardiology resident starting his residency?
You know, like I'll drop a bomb on your show. Do you know MBBS की real value क्या है?
What's the career graph for a cardiologist like? Immediately after doing DM?
When I got out of DM, I got an opportunity where people were giving me a month.
Hey guys, welcome to the Nachiket Bhatia Show. Again, very excited to announce today's guest. He is a senior interventional cardiologist at Maharaja Agreshin Hospital in New Delhi and vice chairperson of the complex coronary program. He completed his MBBS from Maulana Azad Medical College, then DNB in Pediatrics from Artemis Hospital in Gurgaon, and then DM in Cardiology from the prestigious Jayadeva Institute of Cardiology in Nama, Bengaluru. His clinical work focuses on complex angioplasties and structural HAIRE procedures. He has expertise and skill for using all high-end hardware and technologies which are required for modern-day angioplasty. He is well known for stentless angioplasty and for bypassing the bypass. He was one of the youngest national faculty in the field of interventional cardiology. He has also the experience of proctoring complex procedures at various centers across the country. In addition to his hospital role, he is the co-founder and director of NDDCC and has authored multiple research publications in the field of interventional cardiology and cardiometabolic risk. He is also a very dear friend. So let's put our hands together and let's welcome Dr. Siddhant Trehan. So hi boss, welcome to the Nachiket Bhatia Show.
Thank you TNBS. Finally I'm here, right?
Dr. Siddhant, I've heard a lot about you. You have been an exceptional doctor, exceptional student, doing all the major colleges of the country. You are a cardiologist. We're going to discuss everything about cardiology in detail, medicine as a branch. But I would like to know your journey. When did you first decide, or it was decided for you, I don't know, that you will enter MBBS?
So actually this is quite interesting. I think I was never meant to be a doctor in the first place. I was always a very avid sports student and, you know, a sports person. Like I was playing all sports. I played under 15 for Delhi and then I was also playing football for clubs and everything. When I was in 9th standard and I thought I have a bright brain, let me be a scientist, you know. And I was all prepped to be a scientist, get into research. Us time I was like, quarks hote hain yaar, quarks mein kuch ghusenge. But then when I realized that, you know, like my father happens to be a cardiologist. He was the head of Panth Hospital. So I saw the amount of respect he would command. Like he walks into a room and sab log, oh, Trehan sir aa gaye. And then I was thought to myself, yaar, ye respect chahiye. Jo marzi ho raha, ye respect zarur chahiye, kyunki ye matlab kuch hai isme. So then I was like, okay, fine. You know, let's think about becoming a doctor, even though I absolutely hated biology. I hated biology to the core. But then I chose it because I thought I want that respect. And same thing happened when I did my 11th and 12th as well. I became a doctor out of sheer luck. I was lucky enough to get into Maulana Azad. And I was the person who got the least marks in biology who ever got into Maulana Azad. So it was purely physics and chemistry which got me into, MBBS and got me into Maulana Azad. And it's one of the things which I look back, ki bhai, aa gaye, shayad kismat thi. It was some, you know, like one of those permutation combinations that it's just driving you till there. So that's how somebody who did not want to be a doctor, wanted to be a scientist, eventually ended up, you know, getting to Maulana Azad and, you know, आज आपके साथ बैठे हैं तो स्टोरी ठीक ही रही है.
So basically you come from a royal family of doctors. Your father is the Vijay Trehan, one of the most revered cardiologists in the whole country. Now how did you handle that kind of pressure?
So coming from a family where, you know, your father happens to be such a well-renowned and in the field of interventional cardiology, like you go across the country, you talk to any interventional cardiologist and they all know him. In fact, today, most of the interventional cardiologists who are somewhere, they're probably his students. And if I go to a conference now and he's standing there, like koi banda, if he walks, let's say 100 meters, they'll have at least 20 people who come and touch his feet. So coming from this sort of a background was damn difficult. And on top of that, he was the head of Pant and I was in Maulana Azad. So if I did anything wrong, like वो है ना कि परिंदा भी पर मारा तो वहाँ खबर पहुँचती थी. तो literally me doing anything like bunking a class, saying something to a teacher, getting into a fight, whatever, सीधा phone जाता था dad को. So it was damn difficult during my MBBS. And then a lot of people consider that, like if he's such a great interventional cardiologist, it's got to be easy for you. But that's actually very wrong. So the reality is, for me to get anything out of that, पहले मुझे DM तक पहुंचना पड़ेगा. Unless I do get to a DM, I mean, what am I going to do? See, the problem and the point is that a lot of people think that it's legacy. Legacy is true for products and businesses, not for skill. Essentially, if you're a surgeon, your hand skill is your hand skill. You can't pass off that hand skill to your next generation. So even being able to get that skill, you have to be a DM first. Once you're there, then it is up to you whether you are able to take it from you and sort of perform in that sort of way. And I feel I'm grateful, and I have to be like I'll cross my heart and I'll just thank God with this, that like any sort of a complex case which he's like you go for it, I just happen to get it, comes to me very naturally, and that's just how I do it. And luckily the growth's been good, and I think in this sort of a setting, having your father respect you as a professional, I think that's the best thing. And I think luckily it's happened. It was damn tough, but yeah, it's happened.
And you had to go through all the loops and jumps, and not even just DM, you had to do a DM from a great institute as well, and you have actually done that also.
So that's actually one of the things, because like if your father is a great person, so it's always going to question आपका बेटा क्या कर रहा है. And if you say कि बेटा भाई इधर उधर कुछ वेलियां मार रहा है, it just feels bad, right? And I think that actually happened to me. So when I got done with my MBBS, and luckily when I went to Maulana Azad, which is a pretty decent med school, I would say. So uske baad I had to drop a couple of years because my priorities had shifted. I was getting into sports a lot. I was just exploring life a lot. So I had 2 years when I wasn't doing anything. And at that point in time, people would ask my dad, हाँ जी पुत्र की कर रहे हैं? And he would be like, वो सोच रहा है. And I mean, a person with that sort of a stature having to, like thoda sa shy away from that question for his son was something which isn't really good. And after that, I did my DNB in Pediatrics. And then when it came to my DM in cardiology, I'll be very honest. So like when I got into MBBS, it was predominantly physics and chemistry. Cardiology came to me very naturally. मतलब जब मैं भाटिया सर की क्लास में होता था या किसी और क्लास में होता था, तो जब टेस्ट होते थे ना, तो मेरे कार्डियोलॉजी में हमेशा फुल आते थे. एंडो में मतलब 50%, नेफ्रो में 60%, बट कार्डियोलॉजी में हमेशा फुल आते थे. सो व्हेन आई गॉट डन विद माय पोस्ट ग्रेड एंड नाउ आई एम प्रिपेयरिंग फॉर माय डीएम, सो अब इट्स अ डिफरेंट प्लेइंग फील्ड. नाउ यूर इन अ प्लेइंग फील्ड विच इज योर्स, सो यू आर प्लेइंग विद कार्डियोलॉजी एट दिस पॉइंट. So I did get a pretty decent marks, and I had the options of going to all institutes except for Pant. That's just one thing which I missed out on, but I had the option of going to all the institutes. And then I went to Jayadeva Institute, which is in Bengaluru, and my father was like, this is the current, it's the best one. There was no doubt. So I just happened to go to Bengaluru, and I think it was probably one of the best decisions which I made.
I have a complaint. 90% of you have still not subscribed to the channel. So before moving forward, please go ahead, press the subscribe button and click the bell icon. So tell me about your MAMC days. How were those?
MAMC days were mostly a relief, yaar. Kyunki, like before that, you're like PMT ke liye padhai kar rahe ho, lage ho, you don't know what you're going to do. And I, to be honest, was never the person who can sit for 14 to 16 hours in front of a book. I would study at max 8 to 10 hours, but I need to go play. I need to, just indulge myself in extracurriculars and everything. So when you're studying and you're giving your PMT exam, there's a big question mark कि क्या होगा भी या नहीं होगा, right? तो जब वो eventually हो रहा था ना, बंदा relieved हो रहा था. तो मैं भी बहुत relieved था. So I got into MBBS, I was like, घुस गए ना, अब निकल तो जाएंगे. तो पढ़ाई भी चलती रहेगी, एक्स्ट्रा करिकुलर भी चलता रहेगा, खेलते भी रहेंगे. So I was also the captain of the MAMC football team. In fact, I'll tell you an interesting thing. So I started a thing called MAMC Football League. In Maulana Azad, which was I think in 2008 or something. So उस time पे IPL भी start हुआ था. So similar concept where you have icon players and you'll sell them with all of that. So that I started, and abhi 2 years ago I was in MAMC again playing football only. तो वहाँ पे मुझे एक जूनियर, सुपर जूनियर नाउ कहता कि वो देख वो त्रेहान सर हैं, इन्होंने MFL स्टार्ट कराया था. एंड आई वाज लाइक यार ये काम बढ़िया करके गए हम, कुछ तो लाइक यू एटलीस्ट लेफ्ट समथिंग बिहाइंड. So MAMC for me, I think, was a lot of relief. You're done with that PMT phase. You're getting to meet a lot of new people.
What made MAMC special for you?
MAMC,
As an institute, why do you think it was special?
I mean, to be very honest, I don't think it was special, but there's a lot of hype about it. So, while you're studying, everybody is like, yaar, MAMC hona chahiye, MAMC hona chahiye, MAMC hona chahiye. But I, to be very honest, today, it's like, I enjoyed Siddhant Trehan being 18 to 23, whether it was MAMC, whether it was a different place, it probably would have been the same thing. Yes, it's good to say कि आप MAMC से थे. It just feels really cool and everything. But I think at the end of it, it's okay. It's just another college. In fact, some of the newer colleges, I think, have much better infrastructure. So MAMC, yes, tag-wise, it's very good. But other than that, it just gives you an opportunity to live in Delhi. I think that's it. Otherwise, it would have been pretty much the same.
So nothing good about academics or infrastructure?
Academics will be good, but academics are good in it more or less, all institutes now. I don't think there's a dramatic difference.
So इतना hype किस बात का MAMC का फिर?
It's I think it has an aura and it has a traditional charm to it, you can say. It's one of the oldest medical colleges. It's situated very nicely right in the heart of Delhi. And when you have this sort of a traditional space, you will always have people who will stay back. So for example, if you're in let's say a less renowned college, it's going to be very likely कि आप अच्छे डॉक्टर हो, आप वहाँ से छोड़ के अपना काम करने चले गए. But when you're in MAMC or you're in AIMS or any of the reputed colleges, there is a high likelihood that you'll stay behind. And when you stay behind, so then it just kicks off that cycle. वो रुका, उसने आगे पढ़ाया और train करा, he will also stay. So that's how the aura gets built up, and I think it's very true. I'm not saying that it's a bad institute or it's not top of the line, but I think it's your journey. You have to appreciate your journey rather than thinking कि आप MAMC के umbrella के under हो. So if you don't enjoy your own journey, then I think whether you're in MAMC, whether you're in Stanford, whether you're in Harvard or Hopkins or whatever, it's going to be absolutely moot. I mean, that's just my perspective.
Then post-MAMC, you dropped a couple of years.
Yeah.
You then chose to do DNB Pediatrics.
Yeah. So
उसकी journey बताओ आप.
So DNB Pediatrics was, my mother's a pediatrician. My father's a cardiologist. I'm one of those lucky kids who's, pleased both of them. In fact, मैं उन बच्चों में से हूँ कि अगर मेरी मम्मी छुट्टी पे तब जाती थी तो मैं उनकी कुर्सी पे बैठ के कंसल्टेशन करी, और फादर अब मेरे अगर कहीं पे जैसे ऑपरेट करने जा रहे हो और ही इज़ गोइंग फॉर सम कॉन्फ्रेंस, देन मैं उनकी कुर्सी पे बैठ के आई एम सीइंग माय पेशेंट्स और व्हाटएवर हिज पेशेंट्स. सो एट दैट पॉइंट इन टाइम इट वाज लाइक मेरे वो 2 साल ना सबसे हॉरिफिक टाइम थे, टू बी वेरी ऑनेस्ट. क्योंकि अब ये समझो मेरा एडमिशन क्यों हुआ था. मेरा एडमिशन हुआ था फिजिक्स केमिस्ट्री पे. जब मैं नीट के एग्जाम पे, फिजिक्स केमिस्ट्री तो गायब, बचा गया बायोलॉजी जिसमें मेरे लीस्ट थे. राइट, MAMC में घुसने के वाले सबसे लीस्ट मार्क्स मेरे थे बायोलॉजी के. अब मेरे को उसी का एग्जाम देना. सो अगेन इट्स नॉट माई लाइक प्रेफर्ड सर्फेस टू प्ले ऑन. सो फर्स्ट ईयर एग्जाम दिया, बहुत गंदी रैंक आई. नेक्स्ट ईयर एग्जाम दिया, थोड़ी सी बेटर रैंक आई. उसमें बैठे रहे कि शायद कुछ मिल जाए. अब मेंटली आई वाज समबडी दैट आई वांटेड टू गेट इनटू like be a clinician because my brain works like that. Like I do algorithms very fast in my mind. कि मतलब ये हुआ, next algorithm. Like I go through my algorithm very, very fast. So I wanted to be a clinician. So it was either medicine or it was either pediatrics. So पहला round of counseling हुआ, कुछ नहीं मिला. Second round of counseling हुआ, कुछ नहीं मिला. Third round of counseling हुआ, कुछ नहीं मिला. Fourth round of counseling में मैं बैठा हुआ था और मेरे आगे 300 लोग थे, और उसमें टोटल पीडियाट्रिक्स की आई थिंक 15-20 सीट्स थी, जिसमें से एक सीट थी गुड़गांव की. एंड आई वाज अ दिल्ली पर्सन, सो आई वांटेड टू ऑब्वियसली प्रेफरेबली स्टे इन दिस एरिया, एंड ऑब्वियसली ईदर मेडिसिन और पीडियाट्रिक्स फॉर दैट मैटर. एंड आई विल टेल यू, आई एम नॉट किडिंग. सो दैट डे आई हैड माई फैमिली वेटिंग फॉर मी आउटसाइड, एंड मैंने जब अपने सामने 300 लोग देखे ना, आई वॉज लाइक डैम डिप्रेस्ड. दैट वॉज द फर्स्ट टाइम आई टेक्सटेड माई पेरेंट्स दैट आई एम एक्सट्रीमली सॉरी, आई डोंट डिजर्व टू बी योर सन. लाइक आई जस्ट wasted 2 years of my life, and अभी भी मैं थोड़ी देर में बाहर आ जाऊँगा और मुझे कुछ नहीं मिलेगा. एंड जब वो काउंसलिंग चल रही थी, ऑल ऑफ अ सडन चीज़ें बड़ी जल्दी बच्चे बाहर जाने लग गए. मैंने कहा वेट अ मिनट, होल्ड अप, समथिंग सीम्स लाइक इट्स स्टरिंग अप. एंड व्हेन आई गॉट टू माई लाइक जब मेरा नंबर आया फॉर द काउंसलिंग, सो आई एम लाइक सर मेडिसिन पेडियाट्रिक्स में कुछ बचा है तो दिखा दो. तो उन्होंने कहा कि हाँ जी गुड़गांव में एक है सीट. मैंने कहा पैक करो. एंड आई एम नॉट किडिंग, दैट वाज so much relief at that point in time, because somebody who aced through PMT, in fact, I'll tell you, I had cracked IIT as well. I'd cracked AIEEE as well. I could have easily gotten DC, IIT Delhi or anything. So somebody who had cracked PMT like that, IIT like that, AIEEE like that, is now struggling for 2 years just to get a basic branch was kind of, it was like frustrating, depressing, or whatever word you want to use for that. So जब वो सीट मिली मुझे, मैंने कहा चलो जी अब Dr. T has arrived. So that just happened, and then I came out and I was like, I'm going to make the most out of this. It's pure luck कि मुझे ये सीट मिल गई है. And if I don't make the most out of it, then I think then it's on me again. It's on me. So I got that seat. Then got into pediatrics. I was a very good pediatrician as well, by the way. I still have a lot of my patients who I used to see then. They still get in touch with me कि sir ये बच्चे को कौन सा formula दें. I'm like sorry, अब दिल की बात करना. Those days are behind me now. So yeah, they're very frustrating, but luckily got my DNB. And once I did DNB, then I had again an open option, and then it was not a big doubt for me whether I want to do cardiology or not. I was like true love. So got there.
Tell me about your DNB days. First year कैसा रहा आपका as a JR1?
So DNB is very different from MD, and at least in our setup, it was very respectful, and you had dedicated work. It wasn't like जैसे MD में होता है कि first year की भाई घिसी लगा दो जो भी है सारा उसके ऊपर डाल दो. It wasn't like that. We had dedicated work. You would sort of understand sampling, how to do sampling for babies, understand basics of pediatrics, understand how intensive care sort of works. So me being somebody who had, again, वो algorithms वाला फंडा बहुत clear था, and मैंने actually MBBS के टाइम पे ना पूरी हैरिसन, घई, नेल्सन सब पढ़ चुका था. Just interest, out of curiosity, that's it. So एक basic बहुत strong था for to be a clinician. So again, it came very naturally. Like it would never happen. My seniors would never say कि तूने ये गलत करा क्यों नहीं, because they would, it would just happen, and they would be super happy कि ये कर रहा. And plus I think one thing which people really miss out on ना as a DNB student or anything is the ability to question. People are so overwhelmed by their seniors that they think यार मैं इनसे question पूछूंगा तो मेरे को पहले ही झाड़ेंगे. But अगर तुम question ही नहीं पूछोगे तो तुम्हें पता ही नहीं लगेगा. And I was one of those kids that I have a very inquisitive brain. I'm like कि sir आपने ना अभी central line डालते वक्त अपना हाथ यूँ rotate किया. ये क्यों किया? There's got to be some reason ना. You have experience. So there is got to be some reason. And he's like मैं ना borders of the artery को palpate कर रहा हूँ कि मैं head पे ही हूँ या side पे जा रहा हूँ. So if you don't question, I think you'll never know. And that's where people lag behind. क्योंकि if you're not learning whatever these seniors have, then it's not going to happen. Because one big difference जो I think we were just discussing now also is that MD में you're dealing with 100-200 मरीज रोज के. So things will come naturally. They'll go to your spinal level. But in DNB, you're not going to be seeing that many. If you don't see that many patients, unless you actually go into the depth of each and every patient, understand what's the thought process behind the management from A to Z, you're just going to be like 3 साल labor करी, बाहर आ गए, exam दिया, and then you'll be thinking, यार, like I'm not good enough to be, independent consultant. मेरे dad की एक वो है, उन्होंने आज तक एक बच्चा fail नहीं किया, एक भी. And I'm like, ये कैसे? ये तो मतलब you're a blessing in disguise for anybody who's coming to give an exam. So इसे यार एक बात बताओ, बच्चे ने इंस्टीट्यूट नहीं सिलेक्ट करा, इंस्टीट्यूट ने बच्चा सिलेक्ट करा है. क्योंकि इस इंस्टीट्यूट को तो बड़े सारे लोग चाहते थे, बट इस इंस्टीट्यूट ने कहा मैं टॉप 7 ले रहा हूँ. करेक्ट or wrong? I mean, I'm talking about Pant, for example. Pant had 7 DM students, and I'm giving an example कि Pant being, one of the oldest and, the most glorious cardiology institutes of the country, 7 टॉप बंदे पंत ने सिलेक्ट करे. अब अगर 3 साल के बाद इनमें से कोई बच्चा फेल होता तो बच्चा कैसे फेल हुआ? ये तो पंत फेल हुआ ना. बच्चे ने आपको अपनी ज़िंदगी के 3 साल दिए कि आप जो मर्जी करो, मेरे से काम कराने काम करो, पढ़ाने पढ़ाओ, ड्यूटी लगानी ड्यूटी कराओ, जो मर्जी. सो अगर बच्चे ने 3 साल अपनी ज़िंदगी को दिए तो बच्चा कभी नहीं फेल होगा. फेल तो इंस्टीट्यूट होगा या सेटअप होगा. सो आई थिंक मुझे ये बात उनकी इतनी सही लगी कि अगर मतलब एक बेसिक रिस्पेक्ट कैसे भूल सकते हो आप? At the end of the day, like anybody who comes in, like as an MBBS or an MD or a DM, yeah, respect them as a person first. बाकी चीज़ें ठीक है, काम कराओ. आई अग्री इन टूडेज डे एंड एज सबका पर्सपेक्टिव थोड़ा अलग हो गया है कि लोग धक्का स्टार्ट गाड़ी ज़्यादा हैं, सेल्फ स्टार्ट गाड़ियाँ कम है. But still, like if you sort of tell them, like reason with them, I think it's not like reasoning with somebody who doesn't have a brain. Because जो भी बंदा यहाँ पे है, they're sensible enough, and I think this sort of toxicity really needs to get ablated from the medical fraternity now. And it's 2025, high time. I think you're doing a great job with being a medical activist, and you're helping a lot of people sort of at least get some peace of mind, right? And I think it's essential.
But don't you think that the toxicity is actually increasing every day?
मेरा MAMC में जब एडमिशन हुआ था तो आई वॉज द सेम पर्सन दैट आई एम. लाइक आई थिंक शायद मैं तब थोड़ा और सोशल था, अब मैं उतना सोशल नहीं हूँ.
अच्छा.
तब मैं थोड़ा और सोशल था. सो MAMC के अंदर रैगिंग बहुत होती थी उस टाइम पे, राइट? मेरा फर्स्ट डे जो था तो मैंने अपने साथ 15-20 बंदे इकट्ठे कर लिए, ऐसे ही गपशप मार के 15-20 बंदे इकट्ठे हो. मैंने कहा ऐसे करते हैं, MAMC में एक नेस्कैफे बहुत फेमस, वहाँ चलते हैं. सो MAMC में उस टाइम पे रैगिंग बहुत होती थी. सो दे यूज्ड टू सेट आउट लाइक सेपरेट कॉरिडोर्स की फर्स्ट ईयर्स यहीं से रहेंगे, नहीं तो सीनियर्स रैग करेंगे. सो आई वाज लाइक यार चलते हैं यार, क्या फ़र्क पड़ता है, ज़्यादा से थोड़ी बहुत रैगिंग कर लेंगे, बट एटलीस्ट विल गेट टू नो पीपल, नो. सो अगेन माई सोशल ब्रेन वॉज गोइंग इन टू दैट डायरेक्शन, राइट? एंड सो वी एंडेड अप एट नेस्कैफे. सो मैं और 15-20 लोग वहाँ पे चले गए. एंड मेरे उस टाइम में ना माई हेयर वाज दिस लॉन्ग. सो आई वाज लाइक जिम मॉरिसन काइंड ऑफ अ गाय, राइट? सो आई वाज इन दैट सॉर्ट ऑफ अ जोन. एंड तो हम वहाँ पहुँच गए. एंड नाउ आई एम देयर. एंड मैंने टी शर्ट पहनी हुई है, बैगी जीन्स पहनी हुई थी अपनी, मैंने चेन भी लटकाई हुई थी. लाइक आई हैड दैट वॉलेट विच हैड अ चेन विच वाज स्ट्रंग देयर. सो आई वेंट देयर टू नेस्कैफे एंड द सीनियर्स लाइक यार ये बंदा अलग लग रहा है, इसको ज़रा एंटे में लो. तो उन्होंने मुझे साइड में बुलाया. सो आई एम टॉकिंग टू द गाय लाइक जैसे मैं किसी बड़े भैया से बात करूँगी, हाँ जी भैया बताओ. इसे भैया नहीं हूँ मैं तेरा. मैंने कहा बताओ क्या हुआ आप, ये मत बोल. मैंने कहा क्या? तो उन्होंने कहा अपनी आंखें नीचे कर, तीसरे बटन पे देख. मैंने कहा बताओ तू हुआ क्या, तू फच्चा है क्या? मैंने कहा क्या होता है ये फच्चा? लाइक आई डोंट नो, आई डोंट कम फ्रॉम दैट सॉर्ट ऑफ थिंग, मुझे नहीं पता यार फच्चा क्या होता है. तो ही वाज लाइक फच्चा है तू, फच्चा है. हम लाइक एक सेकंड बताओ तू हुआ क्या है. कहता नहीं तू अपने तीसरे बटन पे देख के बात कर. मैंने अपनी टी शर्ट पकड़ी, मैंने कहा इस पर तो 2 ही बटन है यार, अब मैं किसको देखूँ, चाहते क्या हो? Then he's like, oh, ये तो भाई मतलब रिस्पेक्ट नहीं कर रहा अपने सीनियर की, ये वो. And I'm like, dude, what the hell is going on essentially? Like, I can't relate to this. So I would say I was also a little soft when I, like mentioned that. But it's just something that I wasn't exposed to. And this was some sort of a toxicity that somebody was trying to impart on me, which got deflected just because of my innocence, I would say. And, वो बंदा भी आफ्टर 15-20 दिन वो चिल कह रहा अरे भाई बास्केटबॉल खेलने में भी चिल. मैंने कहा तो उस टाइम पे उसकी ज़रूरत क्या थी? कहता पता नहीं यार, बट एक वो था कि सीनियर बने हैं ना तो हम थोड़ी सी क्लास लेंगे. सो आर यू गेटिंग माई पॉइंट? ये टॉक्सिसिटी जो है ना, ये प्रॉबली इट्स जस्ट लाइक it's there and nobody is like, I mean there's a lot of complacency about it. Nobody wants to really introspect or interrogate कि ये हो क्यों रही है. So ये चल रहा है, that's it. मेरे को याद है मैं सीनियर बना. So मेरे को कोई बंदा आगे कहता कि इसकी रैगिंग करो. मैंने कहा मुझे नहीं करनी. तो कहता नहीं यार तू कर, तू हमारे बैच का ऐसा बंदा है, तू रैगिंग नहीं करेगा तो ठीक नहीं लगेगा. मैंने कहा नहीं यार मुझे नहीं करेगा. तो उन्होंने उस फर्स्ट ईयर को बोला तू भाई इनको रैगिंग दे. मैंने कहा यार प्लीज डोंट डू दिस. सो द गाय जम्प्ड इन फ्रंट ऑफ मी, लाइक पुट हिज फिस्ट टू द ग्राउंड एंड सेड यो. And I'm like, dude, I'm finding this so hilarious. I'm just leaving. I got up, I left, and it's as simple as that. How difficult was it for me? मैं उसको बोल सकता भाई चल डांस कर.
अगर आपको if you have to suggest somebody if they should become a doctor in this era, what would be your suggestion?
गलती मत करो, बिल्कुल मत करो. So in fact हम जो भी डिस्कस कर रहे थे, या तो आप इंडिया में डॉक्टर हो सकते हो या आप समझदार हो सकते हो. So unfortunately it's a beautiful profession, but you don't get the sort of respect and the return on investment which you would with any other profession at the same time. The work-life balance is the worst. It's absolutely hell. And I think you have to be absolutely dead sure that you want to be a doctor, and don't become a doctor यार cool लगेगा. Yeah, I'll be a doctor कि मैं डॉक्टर सिद्धांत त्रेहन बन गया. Not at all. If you think that you have that level of, like compassion for people. You can understand their problems and you genuinely want to help them. Only then you should consider being a doctor. And at the same time, you would want to be patient, because unfortunately डॉक्टर्स को इंडिया के अंदर देखा जाता है कि आप एक नोबल प्रोफेशन में हो, एंड नोबलिटी का पैसा नहीं होता, राइट? एंड इफ यू आर समबडी हु ऑल्सो वांट्स टू सॉर्ट ऑफ लीड अ डिसेंट लाइफ, you will not be getting that. It's only going to be a few doctors who will make that sort of money, which you know fantasize about, but it's not going to be everyone. In fact, I'll drop a bomb on your show. Do you know MBBS की real value क्या है? MBBS एक लौती डिग्री है हमारे देश में जो आपको एक सर्टन लेवल ऑफ व्हाट डू यू कॉल इट, सैलरी मतलब पक्का कंफर्म कर सकती है. देयर इज नो अदर डिग्री. तुम बीटेक करो, यू कैन हायर अ बीटेक फॉर 20,000. तुम बीआक कर लो, कोई भी डिग्री कर लो, अगर तुम बड़े अच्छे इंस्टीट्यूट से नहीं हो, तुम्हें हो सकता है 20,000 की नौकरी में. बट डॉक्टरी एक लौती ऐसी डिग्री है जो आप किसी भी कॉलेज से करो, अच्छा बुरा जैसा मर्जी, वो आपको बेयर मिनिमम 70,000 की नौकरी पक्का दिलवा देगी. Because you'll always be picked up as an MO for 70,000 rupees or 80,000 rupees per month, depending on where you are. So are you getting it? It's something that nobody thinks of, but technically देखा जाए तो MBBS उनके लिए बहुत ज़्यादा अच्छी है जो किसी और तरीके से एक बेसिक 70,000-80,000 की सैलरी पे नहीं आ सकते. Does that make sense? And then when you talk about scaling up is a different scenario altogether. And like I told you, if you you have the Nachiket Bhatia Show. So you meeting people is a very biased pool. Your sample size is not the true sample size of doctors in the country. You being at the, great sort of a position that you are, you will always sort of at least personally come across people who've made it, right? And the ones who've not made it, they are so many more. Like I would say that maybe for, one successful doctor, there have to be at least 100 or more than that who are just, at the backbone, or who've been backing you up to sort of reach here. So MBBS in general, हमारे देश में is not like, you really need to love it and be very strongly say कि भाई मैं, yes, I want to help people and then I would want to get into this. So that's the only way. Otherwise, maybe, you can spend your time somewhere else as well.
Boss, let's talk about cardiology now. You have gone through the whole system very recently. So what would you say are the pros and cons of cardiology as a branch?
I think there are a lot of cons. The problem is that there's no work-life balance. And unfortunately, it's, demanding, like it demands your time at any time of the day. You have a patient who comes in with an MI at 2 a.m., you have to be there. If he comes in at 4 a.m., like there have been days I've gotten home at 12, went to the hospital at 12:30, come back at 2, gone again at 2:30, come back at 5, gone again at 5:30. So it's extremely demanding. Plus on top of that, you like I said, you will lose a lot of patients. Everybody looks at the hunky-dory side of it. You will keep always as a cardiologist and as an intensivist both, you will see a lot of deaths. So these are, I think, one of the few things which are, bad about it. In fact, I'll be very honest, there have been times when, I get super excited about a very complex case which I do, like, a lot of doctors do. But at the same time, if let's say I've had a very complex case, but it doesn't end out the way that, I would have expected it to be, then I'll be depressed for the next couple of days. In fact, I've had, I've taken sort of online sessions on how to deal with the grief of losing someone. So, again, doctor banna to you got to get involved, right? And as a cardiologist, because you're seeing so many things, it's all out there. So these are the cons, but I think the pro out of it is also going to be the fact that it's the only field where you see instant results. You don't see instant results anywhere else, right? Bande ko heart attack hua, aapne fatafat, angioplasty ki, patient's all fine. It's great. Patient came in with, unko thoda sa dizziness ho raha hai, you checked, heart rate is around 24, 26. You put in a temporary pacemaker, within 30 seconds the patient will open his eyes and get normal. So seeing instant results, I think it's very great. Like, you as a doctor, let's say किसी को infection, आपने antibiotic दी, waiting for 5 days यार, खांसी नहीं जा रही, अभी तक नहीं गई. यहाँ पे 30 seconds, you see the result, and it's really gratifying when you do that. So I think this is the biggest pro of interventional cardiology, that you see your result. Cons would definitely be, the ones which I mentioned. And also there's a lot of saturation, I think, when it comes to interventional cardiology, at least in the big cities, which is extremely difficult for people to sort of now come in and, sort of like make their names. And in fact, agar hum dekhen bhi, to a lot of the interventional cardiologists today who are very famous and who have a decent practice are like, in their mid 40s or early 50s. So essentially, they still are going to be here for another 20 years in the big cities. So for somebody else to come in, it's going to be very difficult for you.
So, do you think that in the current times, maybe an MD or DNB medicine or even MD or DNB pediatrics, they can survive in a top tier city without doing DM? Or is DM a must right now?
I think it's totally up to you. You should be, if you're content being a physician, you should be a physician. But if you want to be more particular about your work, be somebody who's going to give proper, appropriate care to a patient, get into super speciality. There's no doubt that with times and as times progress, a lot of things are going to get into super speciality. And I think, like a lot of people talk about, I'll have to go to 5 people. So if you want the best, you have to go to 5 people. If you want below the best, yes, you definitely have one person who's going to be able to deal with most of the things. So it's totally up to you, but I would still advise that if you want to be in a big city or even coming up right now, you should do it. Because एक बात जरूर याद रखोगे, तो आज जो कर रहे हो ना decision, your practice is going to be 10 years later. So what you're thinking is today, like today, if you think that, super specialists are like outgrowing the physicians, imagine 10 years later. So what is now today is going to be 10 years.
So, आपके हिसाब से answer क्या है? Is DM a must or not? Let's suppose a yes or no question.
For me, I would have done it because I love cardiology. So I think you should do it, but it's not a hard and fast. I don't think it should be कि मुझे करनी ही करनी है. See, again, I'll tell you one thing. So a lot of people come from very different backgrounds, right? So let's say there is somebody, when usually you think about doing a DM or a DNB, you're close to 28, 29, correct? At 28 to 29, a lot of people are going to be married. Some of them will have a baby as well. So if you are going to be married and you have a baby as well, don't you think 3 years giving it to a super specialty is going to be difficult for that person? Because your earning is going to be really less. Your working hours are going to be really less. You're not going to be able to enjoy your baby's first 3 years of life. So I think everybody is going to have different priorities. So as professionally, I think you should do it because it's the right way forward. But I don't think it's if you don't do it, ठीक है, अच्छे physician बनो ना. Like I said that, maximum diseases जो होते हैं, वो कोई भी treat कर सकता है. जैसे ही डिजीज की कॉम्प्लेक्सिटी और सिवियरिटी इंक्रीज होती है, तब आपको सुपर स्पेशलिस्ट की रिक्वायरमेंट उतनी और ज्यादा होती है. सो बी एबल टू ट्रीट द रूटीन और द मासेस वेरी वेल, नो, फॉर very high specific things. Yes, definitely you have super specialist backing and keep your ties very good. Like if a friend of mine, let's say who's a physician, calls me, Siddhant, मुझे यार ये ECG समझ नहीं आ रही, do you think it's abnormal or not? I see it, I tell him, उसने आगे बता दिया, easy. So if your ties are good, so you can very easily survive. But if you want to make it large and, like maybe earn more, so then super speciality is going to be your way forward.
So, talking about cardiology, what's the career graph for a cardiologist like? Like immediately after doing DM, what are the opportunities?
So I've had, just when I got out of DM, I got an opportunity where people were giving me 8 lakhs a month. So, but the point is that they would call you to sort of, remote areas and कि वहाँ पे एक cath lab है, you take care of that entire cath lab, we'll give you 8 lakhs a month. उसके ऊपर if you see OPDs, do echoes and everything, whatever on top of that, like so you can make money. But if you're going to be in a big city where there's obviously going to be a lot of saturation, so you'll maybe earn initially around maybe 3.5 lakhs a month. So that's how an interventional cardiologist would probably start in today's time in 2025. And so, and as you grow forward, if you have
10 years down the line and 20 years down the line, what's the salary like?
It depends. Ki if you are a consultant by yourself, you can very easily reach maybe 20-25 lakhs a month. If let's say you're running your own setup, you have your own hospital, you got your own cath lab, and then sky is the number. You can go wherever you want. And I think the only problem is that if you start your own setup, it's a lot of headache as an interventional cardiologist, because remember that because you have to deal with a lot of death. And if you start a small center and if you have death in India, places get broken. I know a lot of my friends who did that and their centers got, actually broke. Like they were doing really fine. They were making 30, 40, 50 lakhs a month. But एक कुछ mishap हुआ and then कुछ हुआ. So graph's good. It's good. But at the same time, be patient, be content. You'll get there.
So if somebody wants to open up their own cardiology setup, what are the basic prerequisites that are required?
I think, you should have a cardiac surgery backup. You need to have intensivists round the clock. Cardiologists, unfortunately, will always land up with kidney issues and brain issues because, we do have a lot of times brain bleeds or kidney issues. So you should have them round the clock. Ideally, I would recommend that, it should be a proper multi-speciality setup. Let's say if 3 or 4 friends are there, a nephrologist hai, a neurologist hai, you're a cardiologist, you kind of come together and then start a multi-speciality setup. Otherwise, you should definitely, like if you want to do it all by yourself, you need a cardiac surgery backup. You need an intensivist as your backup. You need to have nephrologists and neurologists and neurosurgeons visiting your hospital. Then you need to have a cath lab. Then you need to have a non-invasive lab, which will cater to your echoes and TMTs and all those things. So that's the basic prerequisite. And then that's got to also be backed up by a lot of staff. Because in our field, it happens like that. And if you are going to have like one nurse looking at 6 patients, तो एक VT हुआ, वो पहुंचेगी भी नहीं वहाँ पे तब तक, तो patients will be gone by then. So yeah, I mean, obviously it's an intensive field. You need a lot of sort of support and a lot of things. But जो लोग cath labs, they're opening it in periphery, so they're doing it with less support. They tend to not do complex cases. They will tend to refer a lot of patients, which is okay. I think you got to be smart as well. You got to pick your patient.
What's the difference between interventional cardiology and non-interventional cardiology?
So interventions are going to be always when you're doing something to the patient, when you're doing a procedure on the patient. Non-interventional is going to be somebody who's not doing any procedure on the patient, whether it's radiology, whether it's gastroenterology, whether it's neurology. Whenever you're doing an intervention, you're doing a procedure on this patient. As an interventional cardiologist, you're doing all sorts of interventions, which can be, coronary arteries, stenting, which we all know very commonly. Then there's a lot of structural heart cardiology, which has come up now, where previously the patients who used to undergo bypass surgeries for valve replacements, now we started doing those valves without letting the patient get opened up. Then there's a lot of pediatric interventions that we have. Then we have interventions for electrophysiology, like insertions of pacemakers. We have CRT-D or combo devices, which we call them. We have ICDs. So interventional cardiology is catering to all these procedures which are going to happen on the patient. And when it comes to the non-interventional side, as a non-interventional cardiologist, you're going to be doing everything else. So it could be doing echoes, doing TMTs, taking care of your ICUs, taking care of maybe doing Holters, extended loop recorders. So a non-interventional cardiologist is going to, be catering to that. And like we just discussed this, so in the US, currently, interventional cardiology, 28% seats were vacant and non-interventional cardiology completely taken up because you do interventions by losing your peace of mind. As a non-interventional cardiologist, you're cool, you're chill. कोई नहीं, time है. वहाँ पे time नहीं है. वहाँ पे तो it's like 30 seconds here or there. So that's the life of an interventional cardiologist. That's the life of a non-interventionalist.
You never tried for USMLE?
So those 2 years in the middle was when I was actually considering USMLE. So उस time पे basically, so like I told you, Indian exams में biology based था. US exam was more of a logical sort of a questionnaire, or the exam pattern was different. So मैंने सोचा कि let's go into USMLE and we'll maybe that will be like a different journey for myself. But then when I was those 2 years and I was in it out of it, so मैंने वो Kaplan सब कर लिया था, वो U-World वगैरह सब solve करके बैठा हुआ था. So my dad told me, तो एक बात बता, what do you want to do? I'm like, I want to be an interventional cardiologist. So he's like, do you think you can be my level of an interventional cardiologist if you go to the US? I was like, यार आपके level पे तो पूरा India लगा हुआ है. तो वो तो मतलब मैं आपका 50% भी बन जाऊँ, I'll be more than happy. तो he's like, तू यहाँ पे अगर by chance रहता है ना, मैं तेरी उंगली पकड़ के तेरे को अपने 80-90% तो लाके खड़ा कर ही दूंगा. I was like, okay, ठीक है, ये भी एक बात है. And then obviously being the only child, so that also sort of, played into it. And then I was like, okay, chuck it. Let's just struggle here only for a little bit. And now I can say no regrets. But till the time I got into my DM, at a decent institute, क्योंकि DM में घुस गए तो आपको पता ही निकल जाओगे. But till the time मैं घुसा नहीं था, I always would think about it, like that old crush which you had. So you would always think of it like that. But yeah, all content now.
You were like Sachin Tendulkar's son. You knew that the legacy को तक पहुंचना ही पहले तो 3 डिग्री पार करनी है, फिर लेगेसी का सोचना है.
Exactly. That's the biggest thing. क्योंकि again मैंने जो बोला, it's a skill based legacy. Even if my dad tells me कि इधर तार इधर घुमानी तो मुझे ही है ना. अगर मैं घुमा रहा और वो घूम नहीं रही तो ये बहुत बड़ी प्रॉब्लमैटिक चीज़ है. सो ओके, हमारे फील्ड में ना, सो जो सबसे कॉम्प्लेक्स केसेस होते हैं, दे कॉल्ड क्रॉनिक टोटल ओक्लूजन्स, CTOs. तो जो हमारी CTO बॉडी है ना कंट्री की, वो बहुत ही छोटी है. So my dad was one of the pioneers, or he's one of the people who started this community. It's called chip CTO and everything. And there are very few operators who do this. For the last 1.5 years, I'm also a part of that community. Like I also go and teach and all these things. And उसमें सबसे important चीज़ यही होती है कि तार को घुमा के क्रॉस कैसे करना है, which is the most important thing. And touch wood, like him telling me something, वो मैंने समझा कुछ and उसको apply करा, and then my understanding of it. I think being good at physics really helped me, because your algorithm solving or going through the algorithm works very fast. तो ये नहीं हो रहा, क्यों नहीं हो रहा, ये नहीं हो रहा, क्यों नहीं हो रहा, ये नहीं हो रहा, क्यों नहीं हो रहा. आपने अपनी तार 30 डिग्रीज रोटेट करी, अंदर सिर्फ 15 डिग्रीज हुई. आपकी तार ने आपने उसको क्लॉकवाइज इतना किया, अंदर कितना हो. So you kind of, it just came naturally eventually. So once it did, then it's sort of really, really gratifying that I'm able to do all these sort of cases, and it was damn difficult. The whole world is out there to waiting for you to fail. इतनी बार क्या होता था कि मैं let's say किसी कॉन्फ्रेंस पे गया हूँ, so मैं वहाँ पे अपना कोई केस दिखा रहा हूँ, so मुझे लोगों ने, बेटा तो पापा ने किया होगा. हम लाइक एक्सक्यूज मी, ये हमने किया है भाई, ये तो स्ट्रेट आउट डिसरिस्पेक्ट है. मतलब जस्ट बिकॉज यू थिंक दैट समबडी 2 years आउट ऑफ इंटरवेंशनल कार्डियोलॉजी कैन नॉट डू दिस, दैट डजंट मीन कि नोबडी कैन, राइट. एंड हर बंदा डिफरेंट होगा. सो दिस हैज एक्चुअली हैपेंड टू मी इन द मतलब 2 साल पहले. पीपल वुड कम टू मी एंड टेल मी, ये बेटा आपने पापा का अच्छा केस दिखाया है. एंड आई वाज लाइक, नहीं जी, उनका केस नहीं है, ये मेरा केस है. इनफैक्ट आप मुझसे इसका एक एक चीज़ पूछ सकते हो. सो यू गेट इट. तो वो एक बहुत ही डिफिकल्ट सॉर्ट ऑफ बैकग्राउंड है जिससे आपको निकलना पड़ेगा, एंड टू एस्टैब्लिश योर सेल्फ. So it is now kind of happening. I get invited to a lot of these complex interventional conferences where I do deliver lectures and talk about, different things. And that just sort of, sets the name of Dr. Siddhant in the interventional cardiology field in comparison to being just Dr. Trehan's son.
So boss, what would be your advice to a new cardiology resident starting his residency in, of course, cardiology? How to effectively use his 3 years, how to basically set up a foundation and be the best cardiologist out there?
So I was from Jayadeva. So हमारे जो वहाँ के हेड थे वो डॉक्टर मंजुनाथ थे. Great personality. I think he is the only person जिसको मैं अभी तक मिला हूँ जो good academician, good operator and good administrator, like all 3 in 1. So उन्होंने मुझे एक बात बोली थी जो मैं सबको बोलना चाहूँगा. आपको ये 3 साल दिए, इन 3 साल में दबा के पढ़ाई करो. बिकॉज जब आपके 3 साल खत्म होंगे ना, इसके बाद आप पढ़ाई नहीं करोगे, तो आप एसेंशली अपने आगे की 30 साल की जिंदगी में वही प्रैक्टिस करोगे जो आपने वो 3 साल पढ़ा है. डज दैट मेक सेंस?
Yes.
अगर आप उसके बाद कहो नहीं भाई अब मुझको और नहीं पढ़ना, आई एम गोना प्रैक्टिस व्हाट आई लर्न टुडे, and you have to learn it really well today so that you're able to do a good job for the next 30-35 years. So my advice will be, अच्छे से पढ़ाई करो, understand what exactly is happening. Cardiology, believe me, is the most logical branch. मतलब in fact I tell a lot of my patients, आप अगर ठीक हो रहे हो ना, ऐसा हो ही नहीं सकता कि आपके अंदर दिल खराब हो रहा हो. बिकॉज जो अंदर है वो बाहर दिखेगा ही दिखेगा. अगर आपका हार्ट का पावर कम हो गया या इजेक्शन फ्रैक्शन डाउन हो गया, इट विल शो. इट कैन नॉट हैपन दैट इट डज नॉट शो. सो एज समबडी हु इज गेटिंग इनटू रेजिडेंसी, हु इज गोइंग टू बी सीइंग सो मेनी पेशेंट्स, ट्राई टू कनेक्ट द डॉट्स. इफ यू कनेक्ट द डॉट्स, read up about it and understand it in a very good way, so you will come out as a cardiologist who understands things well, and you'll be able to practice that for the next 30 to 35 years.
So boss, for me, can you basically, from the most potential to the least, give me the top 5 super specialties of medicine?
I think oncology today has to be number one.
We say number one.
Yeah, population is aging, so more people are going to end up in cancer. Then endocrinology, definitely aging people will have hormonal issues. Rheumatology, then maybe you can throw in interventional cardiology somewhere. Gastroenterology after that. Neurology is also a very good branch because you have a patient, they'll be with you for the longest time. Nephrology then, and I mean the rest would be like that.
So you're putting rheumat at the end.
No, rheumat, I put it away right up there. Endo, rheumat, it's got to be up there.
Okay.
After oncology. Though.
Yeah.
So, oncology, endocrinology, rheumatology, immunology also you put it somewhere in the mix. Then interventional cardiology and, everything else. Interventional cardiology, baki sare niche.
Give me like 3 top institutes for doing DM cardiology in our country.
So, best I would say Jayadeva. Hands down. It's phenomenal. It's a 2,000 bedded pure heart hospital. We had 16 bloody cath labs, 12 cardiac OTs, and 4 centers catering to, I think about 2,300 to 2,400 patients on a daily basis. So I think jo exposure, that is phenomenal. So Jayadeva has to be number one. Number 2, I think would be AIMS, because the academics which you have at AIMS is incomparable. It's nothing comes close to the academics that you have at AIMS, and then PGI Chandigarh. So 3, like that.
Give me 2 more then.
So other 2, maybe RML is very good because it gives you a lot of very good hands-on exposure. And then I think Safdarjung Hospital in Delhi is also very good because recently they got new cath labs and they increased their DM seats. पहले 2 ही थे तो बेचारे 2 लोग 36 3 साल करते रहे. Now they have more seats, more cath labs, and they have a pretty good exposure as well.
So, in your opinion, doing DM from a private college, is it worth it?
DM, it depends whether it's a surgical field or a non-surgical field. If it's a non-surgical field, absolutely. What's the harm? If it's a surgical field, then maybe the hassle will be that once your DM is done, you're not comfortable or confident enough to independently operate. So DM from a government institute for a surgical, definitely much better. For a non-surgical procedure, I think it's going to be the same. It's always going to be कि आप खुद से कितना effort मार के सीखना चाहते हो. So academically maybe दोनों same हो सकते हैं. And but surgically then definitely. Like hand skill is going to be hand skill. Unless you do it, you wouldn't learn it.
So where do you see the branch of cardiology in the next 10 years?
I think cardiology is going to change dramatically. You have no idea the things which are happening in our country. Things are changing so fast, so beautifully, I would say. Itna new hardware hai, which is coming into India because pehle it was too expensive. Now it is coming into India despite it being expensive. There is acceptability that these things can happen. So you look at it from this perspective. Cardiac surgeries कितनी कम होने लग गई हैं? Open heart surgeries क्यों कम हो रही हैं? ऐसा तो नहीं हो सकता ना कि लोग कम हो गए, लोग तो बढ़ रहे हैं, but surgeries फिर भी कम हो रही हैं. So the reason for that is that interventional cardiology started encroaching and going beyond boundaries of interventional cardiology and going into the space of cardiac surgery now. And as it grows further, as more and more hardware comes into the country, it's going to be phenomenal. I think there are, like I have had patients who have arrested in the emergency, but we saved them and brought them back to life because we had this hardware available for us. And I think that's a big thing, no? Ki koi banda arrest ho gaya, you got them back to life, arrested in the emergency, massive heart attack, got them back to life. And one of the main reasons why that was because you had exposure and you could use this piece of hardware which saved somebody's life. So our field is very hardware intensive. You use stents, you use devices, you use so many different things. And unfortunately, these expensive hardwares weren't coming to India because it cost you 20 lakhs. A 20 lakh ka valve, how many people in India are ready for it? But now it's changing. So because these things are going to come in, cardiology is going to grow, dramatically going to grow.
Crazy.
Yeah, absolutely. Heart transplants hone start honge. Abhi to heart transplant kahan ho rahe hain? Imagine that. There is an artificial heart concept as well. That's also something which is not seeped in enough. So I think it's going to be great. And I think it should not be a fight between cardiac surgery and interventional cardiology. I think there needs to be a lot of harmony. Because at the end of the day, whether it's surgery or medicine, it's a holistic treatment जो आप एक patient को देना चाहते हो. And in a holistic form of treatment, I think दोनों specialities को एक ग्रॉस सर्जिकल एंड एक मिनिमली इन्वेसिव प्रोसीजर को, दे हैव टू गो हैंड इन हैंड, बिकॉज फाइनल टारगेट शुड बी कि बंदा बेटर करना है, हमारे को अपने देश का हेल्थ केयर बेटर करना है. सो फॉर दैट आई थिंक एक्सेप्ट न्यू मोडालिटीज कमिंग इन, अंडरस्टैंड कि हम इधर भी स्कोप है, हार्ट ट्रांसप्लांट करने का भी स्कोप है, आर्टिफिशियल हार्ट्स लगाने का भी स्कोप है, बिकॉज सब करो ना, क्यों आधे पे क्यों रुकना है, सब करो.
So are you afraid of AI coming into the field of cardiology?
I don't think AI can come into interventional cardiology because this is like diagnostics, definitely, no doubt. But how can you, like, do a stenting or so many? In fact, so I was telling you that today morning, I had like a distant relative of mine. I put 5 stents into his. मैंने initial consent 2 stents का किया था. So you're getting my point. So as you get into the procedure, things will change dramatically. It's like कि आपने ये करा, इसका क्या रिस्पॉन्स है, उसका क्या होगा, एंड हाउ द पेशेंट रिस्पॉन्ड्स टू इट. सो बिकॉज इंटरवेंशनल कार्डियोलॉजी इन इट सेल्फ इज समथिंग विच इज मतलब it is based on so many different factors. So getting AI to do that, I would be really surprised and amazed if AI could do it, but I don't think it's essentially possible. I'll tell you a very interesting thing about interventional cardiology. Whenever somebody operates, or let's say when a cardiac surgeon operates, the heart is usually in a standstill position. Sometimes we do beating heart procedures also, but उसमें भी आप heart को stretch करके उस area को static कर देते हो. या आप किसी भी और organ पे काम कर रहे हो तो वो organ static रहता है, and आपको वो organ 3D में दिख रहा होता है, correct? In most of the scenarios, unless you're doing similar interventional work, whether it's gastro, radio or whatever. Usually surgical procedures में organ आपके हाथ में, वो 3D में है आपके हाथ में, and it's not moving. In our case, what we do is we are operating on the most sensitive organ of your body, which is continuously doing this. So लोगों को सिर्फ ये दिख रहा है ना, but सिर्फ ये नहीं है, वो सांस भी ले रहा है patient. So it's essentially doing this, right? And ये organ मेरे हाथ में नहीं है, मैं इसमें पतंग उड़ा रहा हूँ, बिकॉज वॉट आई एम डूइंग एवरीथिंग ऑन अ वायर और ऑन अ स्ट्रिंग. सो मैं ये वायर इधर घुमाता हूँ तो वहाँ कुछ रिस्पॉन्स होता है जो मेरे को 2D में असेस करना है. Are you getting my point?
Yeah,
so essentially you're flying a kite and you're making certain maneuvers which are going to be happening inside a person's body on a very sensitive organ. तो अगर बाई चांस आप पतंग उड़ा रहे हो और कन्ने गोल हो जाए ना, तो अंदर भी कन्ने गोल हो जाते हैं. सो इसीलिए आई विल रिस्पेक्ट इंटरवेंशनल कार्डियोलॉजी बिकॉज it's a difficult sort of a form of surgery which you're doing, where you're essentially relying on like tertiary movements in a way, कि मेरा movement तो यहाँ है, effect आ रहा है 1 मीटर दूर. So that's why I think interventional cardiology is a little difficult, and for AI to come and pick it up is going to be pretty surprising, I would say.
Thank you so much, boss. But the podcast does not end right now. We do have some rapid fire questions for you. And it's very simple. Simple 2 rules. You have to be super spontaneous and super truthful. A food you can eat every day without getting bored.
I think maybe eggs.
You are an egg person.
I'm an egg person because anything, I'm a hardcore foodie.
Oh.
So it's very difficult for me to eat the same thing all over again. So I think eggs is something, it's a comfort food, so you can still have it and not be very unhappy with it. Plus, you can do eggs in very different ways also. So.
I like eggs too.
Yeah.
What's your favorite food item?
I love sandwiches. I love pizzas. I love burgers. I love dal makhni. I love butter chicken. It's the stretch. It's the stretch. तभी मैं cholesterol की गोली खा के सोता, by the way. So cardiologist, has to do that, keeping your LDL in check.
A trend you think should end immediately?
I think saying bad things about other people behind their back. It just needs to end.
फिर तो हमारी दिल्ली की पार्टी खत्म हो जाएगी.
वो है, but I think it just needs to end. क्योंकि it's just unnecessary.
Your most controversial opinion about relationships?
That relationships should start early, and if they're long enough, then they've proved the test of time.
Deep.
Yeah.
If you could swap lives with somebody for a day, who would that person be?
I mean, Cristiano, anyway. Any day, Cristiano.
You're a football fan?
Oh, absolutely. I told you I used to play professionally as well.
Your favorite team?
Manchester United.
Me
Unfortunately, we're down in the dumps right now, but
I have joined the MUFC club also.
Oh, I was in the MUFC club for the longest time.
My very dear friend of mine is into that. He took me along. मैंने कहा तुम्हारी टीम तो कभी जीतती नहीं है, तुम मुझे फ्री की पार्टी करा के वापस भेज देते हो.
But I mean, we missed the glory days. No? The glory days were great. But I mean, we'll be hopeful कि फिर से
I think
वापस-
everyone is just waiting for those.
Yeah, absolutely. Amori.
What's the funniest thing you have Googled recently?
What is Amorim going to do and how he's going to turn this around? Because I don't find anything. There's no answer to that. So, yeah, pretty much.
किसके बारे में बात करी आपने भी?
Amorim,
Okay. Career risk you are proud of?
getting into interventional cardiology. Because knowing that, your father is in this field, getting into it was sort of, could be a risky business. But I think it's gone well. So, that definitely.
Your definition of success?
Being content where you are and being able to outdo yourself on a daily basis in a very sort of a progressive way. So I think that's what success for me is.
The happiest moment of your life?
I think when my dad told people behind my back that I don't believe the fact that he aise operate kar pata hai. So that was phenomenal for like to hear ki he's talking about you behind your back in such a great sort of a fashion, because again hamare field mein there's a lot of industry involved. So when the industry is involved, so there's the word spreads. So I get told by a different company that अरे sir आपके बारे में ऐसे बोल रहे थे, sir आप ये complex case करना चाहोगे. So that was great, I think.
I can relate to that. But thank you so much, boss, for being such a wonderful guest.
Thank you for having me. It was a pleasure, man. It was a pleasure. Before the show, during the show, and hopefully after the show as well, we're going to be...
I had a great fun, very insightful discussion and a very different perspective. Really liked it.
Thank you so much. Great.
And thank you so much, everyone, for watching today's show. I believe you all have listened to a very different perspective, a different psychology amongst doctors, what doctors should really be like, how thorough they need to be in their skill to actually continue the legacy. And it doesn't matter where you come from, it matters where you are now, how you form your path. Thank you so much for watching today's show. And as always, do not forget to like, share, and subscribe. Thank you so much, and God bless you.